This morning, critics are showing concern over Robert F. Kennedy Jr.'s recent confirmation as Health and Human Services Secretary, wondering if it might spur anti-vaccine sentiment. Our Seattle station found out in Washington, vaccination rates among children have already been dropping.
HealthLink examined how many kindergartners in Washington state have complete immunization of routine vaccines, including measles, mumps, and rubella, or MMR. State Health Department data shows a slight decline. Around 91% of enrolled kindergartners got full immunization in the 2019 to 2021 school years, but it dipped to 87% in the 2023-24 school year.
We have started to see this sort of slow but subtle but important decline in childhood vaccines in Washington state.
Dr. Elizabeth Mead is a pediatrician at Providence Swedish in Seattle. She explains why even a slight dip matters.
So when we talk about something like measles, for example, which is highly contagious, it's actually one of the most contagious illnesses there is. That really requires more like a 93 to 95% vaccination rate in order for the entire community to be protected.
HealthLink analyzed data from Snohomish, King, and Pierce counties showing an overall downward trend of measles immunization among kindergartners from pre-pandemic 2019 to the 2023-24 school year, with King County seeing a 3.4% drop.
They're not going back up where we want them to be.
Jamelia Brown is the director of the Office of Immunizations at the Washington Department of Health. She says the statewide rate of childhood vaccination remains below the federal threshold of 95% immunization of the MMR vaccine.
And then when we see immunization rates decline, we begin to see disease outbreaks in communities, which can have some pretty devastating effects, especially for those individuals who have weakened immune systems or cannot get vaccinated due to medical conditions.
As many as 14 measles cases have popped up in Alaska, Georgia, New York City, Rhode Island, and Texas so far this year, according to the CDC.
A lot of people have come to feel like, well, maybe they're just not around anymore. And so I don't have to be so cautious about vaccine preventable stuff. And unfortunately, it just isn't true.
As for the reasons why we're seeing a dip in childhood vaccinations,
there is no single reason that would explain why people may choose not to vaccinate their kids or not vaccinate them completely.
Brown says parents might be skeptical of the vaccines.
And unfortunately, we are seeing a lot of vaccine misinformation.
What health officials also acknowledge are the still lingering effects of pandemic closures.
Folks just didn't have an open office to go to, or they were worried about going to a medical setting and bringing their young child to get vaccines. So that's when we started to see some of this decline.
Brown and Dr. Mead advise families to talk with their healthcare provider if they have any concerns.
A pediatrician, a family doctor who you trust, who you can have these conversations with in a way that is mutually respectful, that is non-judgmental, where you can voice those questions and concerns.
For HealthLink, I'm Christine Pei reporting.